Hi, I'm Steve Adubato coming to you from the Hyatt in New Brunswick. We're at the PerformCare event, the 50th anniversary, the signing of the 1963 Act. It's called the Community Mental Health Act of 1963, signed by President John F. Kennedy, one of the leaders in this community who's been at it for over 40 years. He's seen an awful lot. He is Joe Masciandaro. He is President and CEO of CarePlus New Jersey. Good to see you, Joe.
Thank you, Steve.
Tell folks what CarePlus really is and why it's such an important organization.
CarePlus is a community-based mental health and substance abuse organization. We provide a whole range of services, mental health, for children, adults, and people with serious mental illness.
Joe, we're talking to folks about the last 50 years. I mean, you've seen most of those years. First of all, how did you even get into this field, and why does it matter so much?
It was my summer job in 1963.
Some summer job.
Yes. I worked at a state hospital for my summer job. Mom, who knew no one, managed to get me a summer job in one of the state hospitals. So my job was to assist people in the hospital. And after a while, I would go into the community and talk to patients who'd eloped, who would run away, to come back. So I kind of made a name for myself because I did this quite easily.
Since you have seen a few things with your vast and impressive background, what would you say the most significant improvements we've made in the past 50 years have been with respect to how we deal with and treat those with behavioral and mental health issues?
I think the 1960s Mental Health Centers Act had more to do with civil rights than with science. It really had to do with asserting the right to people to live, work, play in their homes, in their communities. The stigma about mental illness forced individuals to be institutionalized. So that was really what the Mental Health Center was about, Mental Health Centers Act was about, as well as establishing local control and planning. These were community-based organizations representative of the people who live in that community.
Why was that so important?
Well, because it reflects the needs and diversity of the local communities, hence the service delivery system is more consistent, with local mores and perceptions. I think the big change over the 50 years is that mental health and substance abuse now has more to do with science than with civil rights, although that's still an issue that needs to be paid attention to, particularly when it comes to stigma and other remaining prejudices.
If you were to identify what some of the most difficult challenges, Joe, we face over the next, I'm not going to say 50 years, the next 10 years, if you were to say, all right, we've made a lot of progress in the last 50 years, the law passed in 1963, the Community Mental Health Act of 1963 was critically important. Next 10 years, biggest challenges we face are?
One is workforce development. There is a real shortage of trained experts in mental health and substance abuse. I think integration of mental health and primary care is a huge challenge.
What does that mean? Translate that.
Well, what that means is that we think of mental illness as almost something that's outside of the body, something that is more spiritual in some way. But in fact, mental illness comes from a dysfunctional brain. And a dysfunctional brain in a dysfunctional body is not going to give you good health. So the essence of the challenge is to make sure that we treat the whole person, both body and mind.
And an event like this, bringing together experts, advocates, people from all different walks of life who are committed to this field, why is an event like this so important, so significant to have?
It highlights, the accomplishments and the challenges. Bringing peers together is very important. We function in isolation in our roles. We have individual challenges, and by being with your peer group, you feel so motivated and so reinforced and so repurposed.
What do you mean? It's interesting. You said that sometimes you're isolated. You didn't say silos, but I'm thinking about that. You mean you're doing what you do every day and you don't get a chance to recognize, celebrate, share with each other?
What we see as, exceptional circumstances, such as the aftermath of Sandy, are really...
Talk about that.
They're really everyday events. They happen in small scales, whether trauma occurs in a family situation or because of a crime or because of, unpredicted violence and so on. Those are the kind of things that are everyday business in a mental health center. We see that every day. So that's kind of the isolation. You really are dealing with people who are in crisis, families who are in crisis, and they're looking for you to help. And at the same time, you kind of feel like helpless. And how much more can I do? How much are they going to contribute to their recovery? How much is science going to contribute to their recovery?
For some of those who really suffered in Moonachie and other communities, who experienced some mental health issues, do you think that was shocking for them? They never expected that?
Sure. Trauma affects each one of us. And just what trauma does is really change the brain chemistry. So it's not that you have just a memory of the event. The event is imprinted in the way you feel, the way you act, and the way you think. And so getting appropriate treatment for that condition is really the key to recovery.
How important is it to help those people understand that, quote, there's nothing wrong with them, but they need to ask for help and they shouldn't be embarrassed about that?
It's essential, and again, that plays into the overall stigma about mental health, that people see experiencing trauma as a sign of weakness. And in fact, it's a normal reaction to a stressful event.
Is it normal?
Yes, absolutely. Of course. Post-traumatic stress disorder is a diagnosable condition. But you really can't make that diagnosis until several weeks or months after the event occurs. So initially what you're dealing with is a normal stress reaction. If you don't treat that, then eventually your brain gets hardwired, to experience the condition on an ongoing basis. And so getting treatment early is the most effective intervention, but then following up is even more important.
Thank you, Joe.
You're welcome.